Okay, so we've talked a little bit already about the rationale for why exercise and stimulant abuse, and there are certainly some similarities with rationale for why exercise and depression. But certainly there's been several studies that have shown that there's a reduction in depressive symptoms associated with exercise that's either done alone or in combination with other treatments. Exercise is ideal because it can be used in populations where medications are contraindicated. Exercise, of course, can improve general health status. It can also improve secondary risk reduction in MDD with things such as cardiovascular disease and obesity. It can help alleviate side effects of antidepressants, such as weight gain and insomnia, improve memory and neurocognitive function, increase quality of life, and as Chad discussed, there's certainly a plausible neurobiological rationale in that depression affects dopamine and serotonergic function, and exercise affects that as well. There have been several epidemiological studies that have been done. This is just a sample of one that looked at the ACLS study, looking at the association between activity and depressive symptoms in both men and women. And basically, with higher levels of activity, we see a reduction in report of depressive symptoms. And as I mentioned, there have been several studies. This, again, is just a sample of one that is used as an example, but there have been several others that have shown that using exercise has reduced depressive symptomatology. This particular one was in 156 older adults with major depressive disorder. And in this study, they could walk or jog for 3 times a week for 30 minutes at 70 to 85% of the heart rate reserve. And there were 3 treatment groups. One was sertraline alone, which is an SSRI. One was the exercise I just mentioned, and then there was a group that had the combined treatments using both of those. And all groups exhibited significant symptom reduction at week 16. And they also looked at individuals after 10 months to follow up, and the exercise, those folks who were exercising had less relapse. So as Mark mentioned, sort of our introduction to work in this area was with collaboration with the Cooper Institute and Andrea Dunn and others with the dose response study to look at exercise as a treatment for mild to moderate major depressive disorder. And Mark kind of went over this already, so I'll skip this, but basically we had the 5 different treatment groups, one with a higher dose exercise 3 or 5 times per week, one with a lower dose 3 to 5 times per week, or a stretching control. And then the primary outcome measure was the Hamilton Rating Scale for depression. And as he mentioned, he talked a little bit about this. This is looking at the data a little bit differently, looking at rates of response. So typically in the depression studies, and many of you may know this already since it looked like several of you are doing work in depression, that we often target a reduction of 50% or more in symptoms on the Hamilton or other depression scales, and that's what we refer to as a response. So in this particular study, the higher dose exercise individuals had a higher percentage of response, significantly higher than the low dose in the control group. And if we look at rates of remission, again, the high dose exercise was associated with significantly higher rates of remission. And remission, as I'll talk about a little bit more, it's very important for the treatment of depression to make sure that we get folks to minimal or absence of symptoms. So that's why the target of remission rather than response, and that's just because remission is clearly associated with better outcomes than just getting a response alone. But again, so the higher dose exercise was associated with higher rates of remission, and as Mark mentioned, the frequency of exercise did not seem to impact the results. So in conclusion, the conclusions from dose was that exercise does appear to be effective monotherapy for symptoms of mild to moderate MDD. The volume of exercise to reduce symptoms of depression is comparable to consensus public health recommendations for physical activity. Exercising 3 days a week is comparable to exercising 5 days a week. And reductions in depressive symptoms with higher dose exercise is similar to reductions seen in other studies of effective antidepressant treatments.